Stick them on a heart monitor right now. Seizure precautions, change in LOC. So, chest talk sign, really funky. How we used to diagnose hypocalcemia a long time ago. If I thought your calcium level was low, I could come up and start tapping your TMJ joint, and you would wince. Serious as a heart attack, it's really funky. It's just it's a neurological deficit. If you don't have enough calcium in it with the musculature that sits there, it's criminal. Another way, true soul sign, is we put a blood pressure cuff on them and start pumping them up, and all of a sudden their hands will just do this. It's really funky. Because you know, when you do a blood pressure, most of the time the arm will just stay down, right? You clamp it down, and all of a sudden the hand just contracts up. Hypercalcemia. It causes muscle weakness, fatigue, confusion, EKG changes, caused by renal failure, dehydration. Interventions. Hypercalcemia, first thing I'm going to do, I'm going to send your ass off to dialysis. I want that pulled off right now. It's too high risk. It's going to mess up your heart. Put them on a heart monitor. Calcitonin is a drug we can use, but I've seen dialysis a lot more. Phosphorus. Again, you need it for muscle contraction. Maintains our heart rhythm, nerve conduction. And remember, phosphorus regulates calcium. Remember, they have the inverse relationship. Okay? What's it caused by? Puking your toenails up. Burns, renal failure. What's it look like? Weak pulses, seizures, decreased cardiac output. Bradycardia and bradypnea. What's bradypnea? Slow breathing. Slow breathing. We can treat it with Nutrifos, K-Phos, or vitamin D. Hyperphosphatemia, because of that inverse relationship. Focus on the hypocalcemia. Treat it, the phosphorus will get driven from the bloodstream. And a couple of drugs we can use, Diamox, Foslo, and Renagel. But very rarely have ever seen hyperphosphatemia. All right, I'm going to scroll through this real quick because I want to. Hypomagnesium. Hypomagnesium. What's that rhythm on the board?
The shots.
Did I tell you guys a story about the kid throwing me the bag of magnesium? Yep. This Torsades is a version of V-Tac. It will kill your patient. So how do we fix it? IV potassium, for the love of God. If you see that, I hope they're already on the monitor because that's what you see, right? Hypermagnesium, I don't think I've ever seen it. That's a nice supply. It's got a whole bunch of your goodies on it. Related causes, what does it look like? Related causes, and what does it look like?
Is that one for the hyperkalemia?
That's for hypo and hypernatremia, hypo and hyperkalemia, hypo and hypercalcemia. Got three of the major electrolytes right there.
Okay, I just thought you pointed me to one. That's
No. Oh. Good question, though. Thank you. infusion therapy, isotonic solutions. Isotonic solutions match your blood, your healthy blood. That's why our favorite to give is sodium chloride. You sure?
Yeah, I'm okay.
Oh, okay.
Thanks, so.
Okay. Hypertonic means it has more parts in it. The D stands for dextrose, half normal saline, or dextrose 5% full normal saline. Okay? So the extra part on that is the sugar. You see it? Hypotonic, half normal saline. Because 0.45 is half of 0.9. Okay? Other infusion therapies we will give, we already talked about blood products and a whole bunch of different meds. Vascular access devices, real quick. You learned in skills lab how to start a peripheral IV, yes?
Yes.
Got the little bitty catheter, like 1.5, 2 inches long. Sits on top of a needle. We use the needle, bevel up, slide it into the vein, right? Then we pull the needle out, get rid of the pointy part out, throw him away, we keep the catheter in place, yes? There's also such a thing as a midline IV, where it's surgically placed. Don't confuse it with a pick. It's usually put in the AC. It's about, I don't know, 18, 20 inches long, or longer. A central catheter can be tunneled or non-tunneled. That means it's going deeper into a deeper blood vessel. Those are surgically placed. And then there's such a thing as a PICC line, a peripherally inserted central catheter. Okay? They're long. They're like this long, ladies and gentlemen. They're surgically placed up here in the upper arm, and it goes all the way to my heart. Which is why when they're putting them in, it's a sterile technique. Alright, they put a big old sign on the door and close the door and says, don't do this, don't come in here. You wear a mask, I wear a mask, we place it via ultrasound, it gets threaded up to the heart. So when you have to do a dressing change on this, you think that's a sterile technique too? Absolutely, because that's a straight line to my ticker. Okay, one of the skills you're gonna learn next semester is how to do a central line dressing change. Okay, and when you are fiddling with this PICC line, which might have 1 or 2 or even 3 ports on it, it is an absolute necessity that you scrub that hub when you get ready to attach a fluid to it. Because I don't want to be the one that injects some weird ass microbe that's going to go to somebody's heart and give them endocarditis and then they're going to die. Okay?
Also, you have to watch for it facing down because it will make rhythms.
Oh yeah, if you get it in the wrong spot, it'll give you all kinds of special rhythms. If they place it even worse, it can end up in the lung and cause a pneumothorax. What's that mean? Collapsed lung, a hole in the lung, if it's placed wrong. Then we've got something called implanted ports. Anybody ever heard of those? Yeah? Cancer patients, yeah. I want you to visualize me holding 2 nickels stacked one on top of the other. Okay, that's what they look like. And they place them, no, I'm not undressing, I'm showing off my clavicle. They place them subclavicular, right under my collarbone. Okay? And it's going into my blood vessel. Now the really cool thing about these ports, okay, the top layer that we plug into, is that they're self-sealing. So the surgeon's got it in, he stitches it into place, okay? But when I as a nurse have to access the port, I use something called a Huber needle, Huber. It's this gigantic 90-degree needle, okay? And it goes through the skin, and I got my gloves on, I use my 2 fingers and I hold it in place. I pin it down so it can't wiggle around. I've cleaned off the area and then I, right through the skin, you'll feel it when it goes into the port. It goes in, and then you cover it with a sterile dressing, and you've got your access ports coming out. Please, please, my darlings, as new grads, do not fiddle-faddle with a port, ever, unless you have a direct order from a physician. Everybody's like, oh, he's got a port, you can just draw blood off that. No. That is the patient's lifeline for their chemotherapy. Don't mess with it. So the cool thing is when it's time to disconnect it, you put your gloves on, peel off the dressing, you just pull it out, put a Band-Aid over it. Throw that in the sharps container. And it self-seals. It'll close up on itself. You guys know what I mean when I say self-seal? It's like the syringe, it's like the vials for insulin. When you put a needle in, when you pull it out, you tip it upside down, it's not gonna leak. It'll self-seal, that's what I mean. Okay? Dialysis catheters, I've seen them in the groin, which is rude. I've seen them in the external jugular, and then I've also seen them off of an AV fistula, where they'll plug in. Again, don't fiddle with these unless you have a direct physician order. Okay, dialysis nurses are certified to know how to manage those. Okay?
And we restrict that arm completely, right?
Yeah, I don't touch that arm at all. If they've got an AV fistula, you leave it alone. Complications to IV therapy, infiltration. What does that mean? Yeah, that catheter has slipped right out of my blood vessel, and now whatever that infusion was that's going in is either going subcutaneous or into my muscle tissues. Okay, you think that's good, bad, or ugly? Ugly, that's painful. Don't do that. What's phlebitis mean? Irritation. I gave them some potassium and it burned them. So now that insertion site's now all red and inflamed and pissed off at me. Both times, discontinue those IVs. You should not be using them. What's a hematoma? A deep bruise. A deep bruise. I've seen nurses go digging for IVs. We used to call it going fishing. Don't do that. If you don't hit it after 2 sticks, you and your patient need a break. Call somebody else in to do it. Okay? What's a localized infection look like?
Swelling, redness.
Swelling and redness. The weird, ugliest one I ever saw, there was green goo coming out of the insertion point. Think it's a good reason to pull that puppy out? Systemic problems, septicemia, is a blood infection coming from an IV site. All right? Fluid overload, we done gave them too much too fast. An air embolism. How many of you guys ever watch the shows on TV and it's like, oh my God, there's air in the IV. They all freak out, right?
Yeah.
It takes about 2 ounces before it causes a real problem. I still do not promote that you inject air into somebody's IV. All right? Make sure the IV is always primed before you attach it. Okay? And then I mentioned the pneumothorax from when they placed a PICC line inappropriately. And it slipped out of the blood vessel and decided, hey, I'm gonna go find your lung.
What about pulmonary embolism? Pulmonary embolism, like if we go fishing and you have to pass out.
Pulmonary embolism means a blood clot in my blood vessels in my lungs.
Wait, say that again?
Pulmonary embolism is a blood clot that has found its way to the vasculature of my lungs. Okay? Remember an emboli
Yeah.
is a DVT that went on vacation. And the places that they love to cause havoc, head, heart, lungs. And the lungs would be a PE. Okay? Arterial therapy, art lines, the main thing I want you to know about them is that they can give real-time blood pressure. Real-time blood pressures, they're cool. All right, they go into the radial artery, which is the one that sits right off your thumb. Okay? They stick that, they stick that catheter, sits right up into the right atrium. All right, and it will give you real-time blood pressure. Now here's the trick. You've gotta have a pressure bag and a heavy dressing to hold this in place. Because if you don't, your body says, I don't want that in there, and it's gonna shoot it right out, and it's gonna bleed all over the place. So when it's time to discontinue an art line, an arterial line, you need to apply pressure to it, or they're gonna bleed everywhere. It makes a lovely mess. And you need to do neurovascular checks on the hand, because you're compromising the blood flow. Intraspinal therapy, we all know about epidurals for mommies, right? We stick that catheter right in, give them some happy medicine. It has to have a filter. We can also use this for cancer therapy. We always assess the drug response. Is it in the right place? I don't know. Are they getting relief? I had one little lady I was helping who had had an epidural put in. She was numb on one leg and could definitely feel the other. And she could feel the labor. I'm like, you ain't in the right spot, boss. I called the doctor, made him do it. Intraosseous therapy. True or false? Your bones have blood vessels. True, your bones can bleed. So if you have a patient that's in severe trauma or a severe burn, and we've lost, because everything's shut down and all shunted to save the body, you can't find a blood vessel, you can literally have the doctor clean the site, make a little incision, open it up, and then they take this sterile thing, that's a drill bit, and attach it to a super powered drill, just like the stuff I use for Home Depot when I'm building a chicken coop. And they go zzz, right into the long bone. And then they'll give you fluids because your bones have vasculature. It is very crazy. It's only used for short term, usually less than 12 hours, 12 to 24 hours.
Do they mostly use it on kids?
Huh?
Do they mostly use it on kids or does it?
And they'll use it for anybody who they don't have good access and it's a virgin. Yeah, because everything's shut down, and that was the only spot they had, huh? I actually had somebody who used to work here. He was a little cuckoo. He thought he was super macho. He used to be an army medic. I'm pretty sure there was tequila involved. Because when he was in the army, him and a bunch of his buddies all started intraosseous IVs on each other. For the thrill of it. I'm like, you're nuts. You're nuts. He did it. He did it. They all did intraosseous therapy on each other just to see what it was like. I'm like, you're nuts. All right.
You know what I saw a lot in the ICU is the, what's it called, IVs on
Scalp.
the baby's heads and the kids' heads.
You know why they do it on the baby's heads? Huh? They can't do this, and it's real easy to see it.
Yeah.
Top of the feet, top of the head on babies. Now, one of the biggest risks, I'll steal my lighter. You may save a life, but you might lose that leg. Okay? Alright. one. Head, heart, lungs. Okay? Normal values, hypo, hyper. The only thing I would add to it is a second column next to each one. Nursing treatment. Okay? Values. What is the symptoms of it if it's too high or too low? Treatment. Does that make sense? This technique, I've had students use it before. Normal values, symptoms of too high, 3 points. Priority nursing action, symptoms of too low, 3 points nursing priority interventions. All right? Yes, it's a pain in the tush, but it works. He calls it check in, check out. I call it right table.